Evening, everyone. Welcome back to my IVF Fences. Welcome back to the European Fertility Society. And today we have a second webinar this week. Yesterday, I think that some of you may have already joined us, and I'm glad that you are back. And for anyone joining us just today, I hope that you will find this very useful. As you see, tonight we will talk about solo motherhood. And as you can see, Marta Sancho and Dr. Ruth Sanchez are with us. Hello, how are you feeling, Marta? How are you feeling, Dr. Sanchez? Great to have you here.
Thank you, Caroline. We're doing well. Thank you.
Hello.
Thank you.
Thank you very much, Caroline. We're glad to be
Great
here.
to have you. Great to have you, Dr. Sanchez. You had some webinars in the past with us, I remember. It's been a while, so I'm glad that you were able to get back to us. Marta Sancho, she's the coordinator, the director of the coordinating department, right, at Vista Hermosa, and Dr. Sanchez is fertility specialist, and she's here to discuss all aspects about solo motherhood. And as you know, we will start with the presentation on our topic, but afterwards, as always, there will be time for your questions. So feel free to ask anything, and I'm sure Dr. Sanchez, with the help of Marta, will be happy to answer any questions. And also, before we start, as you know, we are here almost every single week just to support you, answer some of your questions, but also support you from that emotional side. As you know, we sometimes do some webinars to support you and ask coaches, fertility coaches, of course, or psychologists, other experts that can help you on your IVF journey. And we here at the European Fertility Society hope that you are able to go ahead with your treatments and simply make better decisions. And so we are here just a reminder that we are here to simply help you out as much as we possibly can as well. And before we start with our presentation, Marta and Dr. Sanchez will say a few things, and of course then we can go ahead with the presentation. Okay, ready?
Thank you so much, Caroline. So my name is Marta Sancho, and I'm the director of the International Department. I've been working in fertility for over 8 years now, and our job at the International Department is to try to make international patients feel as supported as if they were doing the treatment at home, because we know that distance can add to the stress and to the difficulties of an already difficult journey. So our job is to try to make everything as easy as possible and to support all the patients. And today my job is to help Dr. Ruth Sanchez in case she needs any help with her English. She speaks perfect English, so I think I'm just going to be a spectator, but anyway, I'm here if she needs my help.
Okay.
Brilliant. Thank you so much.
Okay. I introduce myself. My name is Dr. Ruth Sanchez, as they have told, and I am working in fertility for about 22 years in the UR Vista Hermosa. And now I'm going to do the webinar of going solo. I think you can understand my English, and I will be able to answer your questions if you have any later. And if I don't understand anything, I have the help of Marta here.
Sure. Thank you so much. So I think we can go ahead with the presentation. So here it is. And yeah, go ahead.
Okay. Well, we begin. The theme of today, as we have been talking about, is the solo motherhood. All you need to know about it. Well, in recent years, the number of women who have decided to face motherhood alone has been increasing. The main causes have been the modernization of the mentality of the society and the improvements in assisted reproductive techniques. Generally, these are women between the ages of 35 and 40 years old with a high level of education or a qualified job with economic solvency who don't have a partner and are within the age limit to achieve pregnancy. According to the Spanish Fertility Society, it is estimated that around 1,500 women without a partner decide to undergo assisted reproductive techniques each year. However, there are still many women who have many doubts and uncertainties when facing rearing a child alone, as well as the idea of preparing for their adaptation in a society with a father figure. On the one hand, it is essential to have the support of close friends and family who understand their personal situation and don't prejudge, in addition to provide help when it comes to reconciling this situation with work life. Other fears that may arise when facing motherhood alone are the personal economic situation and the additional expense that it may entail. For this, it is very important to have a good social support. In addition to the figures of family and close friends, it is vitally important to be in contact with other mothers who are going through or who have gone through the same situation. Knowing each case closely can help convince oneself that there are no barriers when it comes to achieving our dreams and that we can become positive references to others. When the option of solo motherhood is undergoing a fertility treatment, it is important to have the maximum information possible and all the answers to our doubts. This grants us greater security and confidence, and it is important to find a center that generates trust and security for the entire process. At the Vista Hermosa reproduction unit where we work, we are aware of these needs, and we know that women come to us after a hard process of reflection and reaching a difficult decision. This is why, from the outset, they need all our support and understanding. We have a sperm bank that allows us to make the best choice of donors after a scrupulous selection process. We offer different possibilities of reproductive techniques according to the characteristics of each woman and her special circumstances, both emotional and financial. The techniques offered to women without a male partner are artificial insemination, in vitro fertilization, both with donor sperm, egg and sperm donation, or embryo donation. One of the fears is how we select the donor of the sperm. When selecting a sperm donor, a series of strict controls are put in place, which go beyond those required by law. We perform psychological, genetic, and medical controls in order to confirm the suitability of the samples. One of the advantages of our unit, of our reproduction unit, is that we have our own genetics unit. So we have the possibility of carrying out genetic studies on our donors to detect diseases that can be transmitted to offsprings. In addition, we also use an artificial intelligence system called Phenomatch, which allows us to select the most suitable donor based on physical and facial characteristics. Before deciding which technique we are going to use, a series of medical tests must be carried out to assess the ovarian reserve, the morphology of the uterus and ovaries with an ultrasound, a vaginal ultrasound, the permeability of the tubes. And according to all of these results, according to the age of the patient and her medical and family history, we will decide which technique is the most appropriate for her. In treatments using donor sperm, in order to carry out the best possible matching and minimize the risk of genetic disease in newborns, we recommend performing a genetic test for recessive diseases in the patients. This test is a blood test. Will find out if she is a carrier of any of these genetic illnesses, and if there are any mutations detected, we can select a donor without the same mutation in order to avoid the risk of transmitting the disease of any offspring. Now I'm going to talk about the different techniques. The first of all is the intrauterine insemination with donor sperm. It consists of introducing a concentrated sample of the donor's sperm inside the uterus of the woman, so that the pregnancy is achieved naturally inside the fallopian tubes. Between the artificial techniques, this technique is the more natural. This technique doesn't require anesthesia, analgesia, and is usually performed after a light pharmacological ovarian stimulation. The next step will be the in vitro fertilization with donor sperm, the IVF. The in vitro fertilization consists of stimulating the ovary to retrieve as many eggs as possible and fertilizing them in the laboratory, that is why we call it in vitro, with the donor's sperm. This allows us to obtain a number of embryos, which will later be transferred to the maternal uterus, usually in day 5 of development. We call it the blastocyst stage. The decision of the number of embryos to transfer, 1 or 2, must be agreed between the patient and the doctor, depending on the age, the medical history, and the personal situation of the patient. The in vitro fertilization also allows us to perform a pre-implantation genetic diagnosis test called PGDA. This is a test that checks the chromosomal endowment of each embryo and allows us to select the most suitable embryo for transfer. The use of this technique is indicated in certain cases, mainly in advanced maternal age or when being carrier of some chromosomal alterations. If we have several embryos at day 5 of development, the best quality embryos will be transferred first, with the option of freezing the rest for further attempts in the event that pregnancy is not achieved with the first transfer, or to try for a second child later on. Another step is the IVF with double donation. We mean an egg donation and a sperm donation. This in vitro fertilization with double donation consists of performing a conventional in vitro fertilization but using eggs and sperm from donors. This treatment is performed when it is impossible to use the patient's eggs, either because of age, when her ovarian reserve is practically exhausted, or in that cases when she is a carrier of a transmissible disease and the use of donor eggs is recommended. This is the technique with the highest percentage of success, since it is performed with donors who by law are all under 35 years old and subject to exhaustive controls. And the next step is the embryo adoption. This is another option for those women who have to opt for donated eggs and sperm. Usually, these embryos comes from a previous cycle of double donation when the surplus embryos have been anonymously donated. It has the advantage that it is less costly than the double donation treatment, but the main disadvantage of this technique would be that they are all frozen embryos that have already been generated, which makes the physical matching more difficult, as we will not be selecting the donors separately. However, it's a very, very good option to consider and with very good success rates. Well, to conclude, we must be aware that solo motherhood is an increasingly present reality in our society, and that reproduction centers must support these women and offer the best possible results with the maximum security. At Vista Hermosa Reproduction Unit in Alicante, Spain, we encourage patients who are thinking of becoming single mothers to contact us, obtain all the necessary information to clarify their doubts and concerns. We are here to help them. Well, This is all I wanted to say, but I'm sure that you have a lot of questions that I will be very glad to answer.
Brilliant. Thank you so much indeed, Dr. Sanchez, for your presentation and giving us some options, available options that a solo mother can go ahead with. So we have embryo donation, embryo adoption, of course, looking for sperm donor. So there are options. So who's ever wondering what can be done, there are options. So I hope that was, of course, useful for you. And right now, as Dr. Sanchez has already mentioned, it's time for your questions. So as you know, just type those in the chat. I see some questions right here. So don't hesitate. This is your time. Anything that's on your mind, you can ask, and I'm sure we'll be happy to help you out with those. So let me go to the first question that we got. I'm not sure also what it is. If you can see, what is analgesia? I'm not sure. I'm afraid. If you can
Well,
help with that.
analgesia is analgesic like paracetamol or the pills for the pain. It's me, and I said in the intrauterine insemination, we don't need anesthesia. We don't need to because it's not painful. So in the in vitro fertilization, we have to take the eggs from inside the abdomen. So it is doloroso, painful. It is painful. So we do it under anesthesia, and usually they need some analgesia. They need ibuprofen or paracetamol. In the intrauterine insemination, we don't need any of this because it's absolutely painful, not painful.
All right, thank you so much for explaining to so everyone. I think it's pretty clear for everyone right now. Okay, let's go ahead. There are short questions, but getting more and more of those. Can you recommend any sperm banks that you cooperate with?
Well, we have our own sperm bank, so we use our own sperm bank. Yeah, I don't know that perhaps Marta can have more information about the sperm banks in other countries, but we work with our own sperm bank.
Okay, all right, that makes sense. So only your own banks. You don't cooperate with some external ones. That's probably
Well, if
the question.
sometimes if we need a donor with very specific characteristics with another ethnia or some characteristics that we don't have, perhaps I know that we have contacts with another sperm banks, but I cannot tell you with whom because it's a theme of laboratory. So the embryologists have more information about this. But usually we don't need to another sperm banks. Just in case we need a donor of another ethnia, such as Asiatic or something like that.
Right, of course. Then you need to explore some other options, obviously, because it's harder to find them. Okay. Hope that helps, Felicity. There will be some more questions in regards to sperm donors. I see them already, but let me go to this one. What information can you get about the sperm donor?
Well, in Spain, the law is very restrictively. It is anonymously, so we cannot give personal details. We can give information about the physical characteristics, age, the color of eyes, the hair, the weight, the height, and the studies, but nothing more. Well, the blood group, and if there is any illness, but the illness that are hereditary, we cannot use these donors. So we cannot have photographs. We cannot show the photographs of the donors and give any personal details.
Exactly. Okay. So this is, we need to explain that because there are some questions you already answered. So it's like sperm donor known. So it's always anonymous in Spain, of
Yes,
course.
it's always anonymous by law.
Of course. Okay. Let me just go to previous one. Do you consider women over 40
Oh,
years
no, I
old?
don't consider a woman with 40 old, even with 50. But it doesn't mean that the eggs are young enough. Okay, it's not the same. Consider a woman old that consider the eggs um, young enough to fertilize. The problem is that nowadays the women with 40 years old are very healthy, and we have very good diet, and we reach this age with a very good fitness. But our eggs have the same age, and it is we cannot do anything to avoid that with these years, with this age. More than the half of our eggs are genetic altered. So, and we cannot do anything to avoid this. So 40 years old, well, if the ovarian reserve is good, we can try using the own eggs. But over 42 years, the results with the own eggs are very, very low. The success rates are very, very low. And so beyond this age, we begin to talk about egg donations, but it depends on the ovarian reserve, and we always recommend to do the test, the genetic test that I have talked about, the PGTA, because we know that more than the half of the embryos will be chromosomically altered.
Okay. Again, thank you for explanation to this question. So yeah, actually, again, you've mentioned this. So can a woman above 43 years old do IVF with donor eggs, as you said? It's
Well,
actually
that's what I
more
have said.
probable, right?
Mhm.
Okay.
Yes.
Thank you. And how about how many times a sperm donor can donate?
Well, in Spain, the law says that a donor can have no more than six childs born with the donation. So if we have to, we cannot use more samples if there are more than six, or there are six childs with the same donor. There is a limit. We cannot use it a lot of times.
There's a limit, 6 children only, of course. Yeah. Okay.
Mhm.
Okay. Next question in regards to donated embryos. So are they available at the clinic?
Yes, we have usually embryos available to be donated, because as I have told, most of them comes from the surplus of double donations, because our success rates are very high with the transfer of double donations. So we usually have more embryos that are frozen, and the patients that are satisfied with their child, they donated them, and we have them in our bank, and we usually have enough to donate.
Okay. Again, thank you, Liz, for your question. And next question from Kay, if you can have a look and clarify. So, is it possible to use a donor sperm and insert it into a woman's egg? As I don't believe I have problems with fertility per se.
Well, I don't understand the
So, not
question.
necessary IVF, right? But there are other options rather than IVF, like maybe
But
IUI in this case.
insert the sperm into the woman egg is an IVF.
Sure.
Okay, we have to
So,
collect the
just
egg before. We cannot insert the sperm inside the ovary. We have to collect the egg and in vitro insert the sperm inside the egg. This is an in vitro fertilization.
right. So, only
When there
this is
there are
the
no
next.
problems with when there are no problems, sorry, with fertility, what we recommend, depending on the age, on the permeability of the tubes, the technique recommended is the intrauterine insemination to insert the sperm inside the uterus. So the sperm will go through the tubes and naturally fertilized in the tubes.
Okay, exactly. I think that was, the question about. But of course, so
Yeah.
that makes sense. And actually, again, a question in regards to that. So, for women over 40, would you always recommend trying IUI with medication, Clomid, instead of natural IUI?
Well, over 40 years, we usually recommend IVF, not IUI, and always with medication, because in a natural cycle, the result is the success is very, very low. In a woman with no problems of sterility, that is the case we are talking about, because we're talking about women without a male partner, that they theoretically they don't have problems of fertility. We can't do intrauterine insemination with 40 years, but with a woman with an sterility, with infertility, um, over 38 years old, we don't recommend intrauterine insemination. We go directly to IVF because of the results. But in cases of no infertility demonstrated, we can do the intrauterine insemination, but till 40 years. Over 40 years, the results are very, very, very low.
Okay. I hope that helps, Liz. So thanks a lot for explaining, Dr. Sanchez, to this one as well. Okay, sorry. Here's the next question from Vicky. Any advice for 34-year-old who's going for her frozen embryo transfer with her last two frozen embryos tomorrow of her first IVF cycle?
Well, I it's your we're going for her first with her last. Well, I suppose that if you have had transferred before, because if these are your last two frozen embryos, you are taking where you are carrying an endometrial preparation, and they will have give you all the medication you need. I don't know exactly what is your protocol of medication, but perhaps you have heparin anticoagulation or corticosteroids if it is not your first cycle. I don't know, but sure you have the good treatment, and after the transfer, okay, there's nothing magical to do for the embryos to implant. So just follow the instructions that the professionals give you, and I hope you have good luck.
Of course, Vicky. Thank you so much. There's one more question actually from Vicky. So, what is the difference in Spain to the UK regarding donors and treatment?
Well, I don't, I'm not sure what is in UK the donors, but I think that in UK it's not anonymous. I think it's a very big difference. And I don't, I really don't know in UK any more different. I don't know. Perhaps Marta has more information about it.
Yeah, that's the main difference. In Spain, donation is always anonymous, and it cannot change at any stage. So even if the law were to change tomorrow, it cannot be changed retroactively, which means that all treatments that have been carried out until the moment that the law changes will remain anonymous. And in the UK, you have anonymous and non-anonymous donation. And the anonymous donation in the UK, when the child is 18, they have the right to find out the information of the donor. In Spain, that's not so. In Spain, it remains anonymous. So there's never the possibility of finding out any information, personal information about the donors. And that's the main difference.
Thank you so much, Marta, for adding this. That makes perfect sense. I think that it's more clear for you, Vicky, as well, and for the others as well. Sylvia has a question. How long does it take to find an egg donor?
Well, we have a big pool of donors, and usually we don't have any problem to find a donor. But if we are looking for a specific characteristic or a specific ethnia, perhaps we can't have more time. But we have not. How would Marta? How do we say lista de espera?
Waiting list. We don't have a waiting
We don't
list.
have a waiting list for the donors.
Okay, thank you indeed for the clarification to this. Okay, yeah, you already mentioned this, so Vicky, I think this is clear. Okay, it's about their donor at a certain age for a health reason. So not
I think
normally,
that
but for
Marta
health
has answered this
reason.
question.
If it's for a health reason, if we have a report from the child because the child has a disease or has been diagnosed a disease, what we advise patients to do is contact us. We provide that report to our genetics department and see if the disease can be carried genetically. If it's an inheritable disease, in some cases, we do have DNA from the donors in our bank that we keep, and that DNA can be studied to see if the donor was a carrier or not of that specific illness. It's something very specific. It's studied case by case, and it's not available to all donors because older donors may not have genetic samples in the bank.
All right. Again, thank you so much, Marta, for adding that. Okay. How about this? Despite the anonymity, can donors' ethnicity, sperm or egg donor, be known? Can we request specific ethnicity?
Yes, the ethnicity, what you can know, and you can request a specific ethnicity, but if it is we don't have donors with that specific, we will say that we don't have available, but it's strange not to have. We usually have.
Can I add just one thing? Because we sometimes have patients that are searching for a donor that don't have their ethnicity. And what we need to be specific about is that the ethnicity must be the one from the recipient patient. So if we have a Caucasian patient, we will always have a Caucasian donor. We cannot choose an African donor for a Caucasian patient. The law in Spain does not allow that.
Excellent. Thanks so much for explaining. This is important to remember about as well, for sure. So we already know the answer, right? So Ambrose, at your clinic, so all are anonymous, of course.
All the donations are anonymous. All.
Okay.
Yes.
Sorry, let me just go through this. Okay, so you answered this in a way. I want to do IVF using a donor egg to have a better chance. I'm above 43.
Yes, it is recommended. I think it's the best technique with the higher success rate for a woman above 43 years old. Yes.
Okay, good. Thank you. How about black or half black egg donors? Are there any available?
What is half caste?
I think half black, I guess. That would mean because it's maybe just like a spelling.
Mulato, Marco?
Será de etnia mixta.
Mixta.
We do have mixed race. Perhaps that's what
yeah, maybe.
Amina means. So we do have mixed race donors in our bank. That's also a possibility.
Yes.
Mm-hmm. Okay. Thank you for the clarification for this as well. Okay, let me just. I guess this is also possible for blue-eye donor. How long is the donor egg donation waiting time? I guess.
No, there is no waiting list. We have blue eye donors.
Okay. And possibly our final question. So if you have more, you know what to do. Go ahead, type those in. So according to your experience, which are the most important aspects a solo mom should consider when undertaking this adventure?
Well, I think that the most important aspects are that they are going to they have to think that the the easiest step is to get pregnant. For me, the hardest is to bear the child because it's forever, and to bear the ¿cómo es crianza, Marta?
The rearing of the child.
The rearing of the child alone without a partner is more difficult because all becomes to you and you have to take all the decisions. So I think that the most important thing to be clear and to have it clear is that you have a good social support, as I have told, and that you are not going to be alone, and that it's not just like I feel like having a baby, but I'm sure that I have to begin this adventure, and this is for life.
Nothing else we can add here, right? This is the truth. This is a very important decision. So actually, one more question that I think Marta can help with. Perhaps you can put some email in the chat. How can I contact you? So I'm sure the team at UR Vista Hermosa would be happy to help you out with any more questions. Obviously.
Of course, I'm going to put our email, and also at the end of the presentation, there's our email address and there's our web page so that you can have access to our clinic. But I'll write it down in the chat room.
Yeah, it's right here as well, as you can see, international at urvistahermosa.com as well. Brilliant. Thank you,
Exactly.
Marta. Brilliant. Thanks a lot. And as I mentioned, it looks like that was our final question. So thanks everyone for joining us tonight. Thanks for your questions. I hope that it was useful. I do believe it was very useful for you and you found this interesting. As you can see, there is a comment here. I don't have any more questions, but wanted to say thanks for a lovely webinar answering my questions. Thanks so much, Vicky, for joining us. Marta, Dr. Sanchez, it was great to have you. Before we finish, anything else you would like to add?
Well, I would like to apologize for my English because I would like to say more things, but sometimes I cannot express what I really want to say. But I hope that they have understood me.
Definitely. You did a great job, Dr. Sanchez. So you shouldn't worry at all. Right, Marta?
Yes, no, I'm just a spectator. I just help a little bit, but the doctor is always very good. So I'm just here as a
Exactly.
support group.
Definitely. So thanks a lot for your support as well, Dr. Sanchez. It was great to have you back. I'm looking forward to some more events. Of course, stay tuned. There are more events. We will be back next week, actually, with one more webinar. We will talk about your IVF journey, how you can prepare. So if this is something you are thinking about, or you know that you are going to start, or even if you are already in the middle, you can join and again, ask questions, learn a bit more. And as you know, we will be back with some more and more events coming up. So thanks a lot, everyone. It's been great to have you and enjoy your evening. And of course, stay tuned. I hope to see you, Marta and Dr. Sanchez soon as well. Thanks a lot. Take care.
Thank you
Bye.
very much. Bye bye. Good night.